We have an understanding with our panelists that we're not going to be doing speeches today. And I really appreciate that. We want to create a dynamic conversation with the panelists. These are extremely knowledgeable and experienced individuals. We want to hear from them and really build on the ideas that they share. But the same goes for your questions during the Q&A. Please do not use your Q&A to make an intervention, but rather to ask a question back to the panel so that we keep this dynamic. And we have a lot of people watching online as well who are going to be sending in their questions, which I will be monitoring throughout the event. Now, let me introduce our esteemed panelists to you now and begin by Dr. Abdullah Hamoud Al-Harti, who is from Oman, the Sultanate of Oman. He is a trauma surgeon by training and a special advisor to the Minister of Health of Oman, who is with us today. Ms. Anne Levy, who is the director of the Federal Office for Public Health of Switzerland. And maybe I can take a moment just to salute both Dr. Al-Harti and Ms. Anne Levy. Their two countries, the Sultanate of Oman and Switzerland, have been the lead sponsors of the Global Health and Peace Initiative in the World Health Organization. And that has reached the point of an executive board decision just at this last World Health Assembly, whose theme was on health and peace for health. So again, thank you particularly to Switzerland and Oman for your leadership in that way. Then we're joined by Dr. Matsidisho Moeti, who's the Regional Director for Africa of the World Health Organization, and His Excellency, the former Prime Minister of Greece, George Papandreou. We also have the former Deputy Prime Minister and Minister of Foreign Affairs of the Republic of Georgia, Yekaterin Tikeshilashvili, and former President of Serbia, Boris Tadic. Thank you, Excellencies, for being with us today. My name is Scott Weber, the President of Interpeace, the International Organization for Peace Building, based in Geneva. We got involved with this Health and Peace Initiative back in 2018 during the Ebola crisis in the Eastern DRC, when we saw just how much the communities were acting were resisting, in fact, in many ways, parts of the health intervention against Ebola, and tragically caused the loss of lives of healthcare workers and of community members. And we worked with WHO and with the Ministry of Health of the DRC and other partners to really understand how to adjust the approaches to work in partnership with communities to turn that tension around into collaboration. Since then, we've seen how the COVID-19 pandemic, which has affected every country in the world, has revealed and exacerbated underlying inequalities and tensions in society that are often at the origin of conflict. We know from our peacebuilding work that most conflicts in the world have at their origin some form of exclusion or inequality, political, social, or economic. And the COVID-19 pandemic, therefore, went far beyond a health crisis. It became a multidimensional crisis in all our societies. Hence the importance of us tackling this intersection of health and peace. In my mind, the health and peace agenda has three main dimensions to it. The first is how health is, whether we are engaged in health or not. It is a common priority for all communities, all groups in society, even those that are fighting one another. And so it is an opportunity, an entry point for trust building. When all else fails, at least people can agree on health as a priority and build on that. Two is that peace building, the work that my colleagues and I do, can create the conditions for health interventions that would not otherwise be possible in countries affected by conflict. And by bringing health interventions following a reconciliation process or a peace process, it actually boosts people's confidence in working together and creates a virtuous circle of trust building. The third dimension is that health is naturally a critical pillar of any social contract in the relationship between communities and between people and their state. When that relationship is, when the health system is weak and doesn't provide in an equal way to populations, that relationship is weakened. When it is strong, that relationship can be strong. So those are three main dimensions, I would say, to the health and peace agenda in my mind. And we have three overarching questions for our panelists today. The first is, how can health be an entry point to build trust in our societies? Two is, what role should the World Health Organization and member states play in advancing this agenda? What do they need to do? What do we all need to do? And the third is, what are practical examples of this in action that can inspire us and help us to emulate this elsewhere? So without further ado, let me begin by asking a question to Dr. Moeti, our regional director of the World Health Organization in Africa. Under your leadership tenure, Dr. Moeti, you have had to deal with some of the most complex health emergencies in memory. Not just the Ebola crises, West Africa, Congo, but also the COVID-19 pandemic and the fight against polio and many other challenges. What examples have you seen on the ground as to the power that health can play in bringing communities closer together in places like Cameroon and Central African Republic and elsewhere where you've intervened?
Okay, thank you very much for this opportunity. Thank you for inviting me to this very important session. I think I can only start by echoing what you've said, that without peace, there cannot be health, and health can be a driver and contributor to peace. And we've seen that in some of the situations that we've had to deal with in the African region. There are examples. One of these is the situation in the Democratic Republic of the Congo, which was, of course, very challenging and resulted in the deaths not only of people in communities, but also of healthcare workers, including of WHO staff members. But we are starting to see some very encouraging examples of an explicit approach that promotes peace through health as an entry point. And one example I can give is in the work that we've been doing on polio eradication in northeastern Nigeria, which was the last country where we had wild polio virus circulating in the African region before we were declared to have eradicated polio. It was truly what you might expect, that in this conflict area, an area of chronic conflict with displacement of people and communities and active conflict, including violence towards healthcare providers, many community health workers lost their lives, really using polio as an entry point, but broadening that to offering to sometimes communities in conflict with each other a broader range of services for health, for vaccination for children, for micronutrients for children, and other health interventions, really did create the opportunities to pause the hostilities, enable the provision of this healthcare to carry on, and sometimes even for communities to be able to move back into their homes that they had vacated. So it did contribute to the peace in northern Nigeria, and certainly the opportunities were created for health interventions to build the connection between people that were warring against each other. We have other examples as well. We have an initiative that WHO is supporting in Cameroon, in the part of Cameroon when there is inter-ethnic conflict. And there again, there have been the opportunity to offer, in very acute areas of conflict, services to both, if you like, both warring parties at the same time, so that people understand that not only people who are seen to be refugees or those who are being looked after by the international community because they're in a humanitarian crisis, but those that maybe they are protagonists or antagonists are also offered the opportunity to have access to healthcare services, and that can make a difference. I believe I don't want to preempt. I know that we have online the Honorable Minister of Health of the Central African Republic, who has been a strong promoter of health for peace in this country that's been going through a protracted humanitarian crisis, who has very courageously traveled with my WHO representative, who by our rules was forbidden to take certain flights and go to certain areas, but who pleaded, and I agreed, that accompany the minister in this very important initiative. And they've really been able to create openings offering basic health services to people. And the minister is very creatively using the COVID-19 pandemic vaccination services to integrate other packages so that, again, you are able to create a sense of being looked after, understood, being cared about in protagonist groups, and create the space for dialogue to start, which will itself contribute to peace. So these are some vivid examples that we are hoping to build upon and to learn from in the African region, because we believe strongly, looking at our region, the West African sub-region, the Sahel, where you have both conflict, climate change, that are really driving impacts on health, where this could be a very important initiative to support all communities and build trust. Thank you.
Thank you, Dr. Moeti. I'd be interested in a subsequent intervention, perhaps, if you can talk about how you're going to use those lessons to help educate other WHO colleagues and other Ministry of Health colleagues on how to do this in other countries, how to inspire them further. But maybe I can turn to Dr. Tkeshilashvili. Apologies. In your region, which has experienced considerable conflict, particularly with your northern neighbor, you have found, as I've come to understand, you've found quite creative solutions to create bridges, particularly to the authorities of the occupied areas in southern Ossetia or in Abkhazia, in order to nevertheless advance development opportunities, development work with them, despite the conflict. Can you tell us a little bit about those experiences?
Sure, thank you. First of all, yeah, glad to be here, and then my gratitude and thank you for organizers of this very important panel. I'll give a bit of a context, I guess, for the audience as well, to have an understanding what the specificity of this case actually means if we speak about what are the entry points and opportunities through the health-related initiatives that one could use in the situation when you have a conflict, which in effect is a frozen conflict of occupation of a large country as Russia is in your own country, which is a small country that Georgia is, which you have two regions of my own country that are occupied currently by Russian military forces, regions that Russia recognized as independent nations, but ultimately is in full control and occupation of those territories, and Russian military forces are on the ground. Why this is important for me to mention within the context of the initiatives that we have pursued since 2008 is that we had a sober understanding what we could have achieved by direct, informal relations or offerings or initiatives with authorities on the ground, so-called governments in both of the regions. We didn't have an expectation, which would have been an exaggerated expectation, that through those openings, we could actually attempt to solve the conflict per se. Because the reality on the ground is that they don't have a freedom of choice even. If we theoretically would have assumed now that their mindset would turn and they would want to resolve the conflict and be part of Georgia and then negotiate the solution of the conflict, they wouldn't have had the freedom of choice. So my takeaway that I would want to deliver in this context is that one needs to have a sober understanding of what is the expectation that one can set as a goal for the engagement of this kind, so that they are realistic, feasible, and don't create disillusionment with what is the potential that can be pursued with these initiatives. Because if you tell to your own population that this is what we're going to do for the benefit of the conflict resolution to solve the conflict, and if it will not happen because the tool itself is not potent for that to deliver, you undermine the very effort for which you do the confidence building measures of this kind. And what I will describe now in terms of initiatives that we've pursued was done with that mindset in mind, that we don't have an opening now, but the opening will come for sure for the conflict resolution. We need to build confidence, trust as a capital that could be used for that momentum when the conflict resolution will become a possibility, so that we have that trust that is built as much as we could have encouraged that to happen. So what we've done already from 2008, late 2008, beginning 2009, we've adopted a comprehensive strategy of reintegration. I was at the time Deputy Prime Minister in charge of this direction. And there were three main elements that we've had in that strategy. One was health, another was education, and then the third was freedom of movement. By introducing special travel documents for the residents of those regions that could allow them to travel to Europe and then to the US as well. But then coming to the health, this became one of the strongest instruments that was used at that time. And then up until now is used by the Georgian government when it comes to that confidence building measures as an entry point for creating that capital for the real negotiations in the future and having that social connectivity. What we've introduced basically is this. Georgia is not a rich country. We don't have abundance of resources to have a free of charge healthcare that would have been fully satisfactory to our own population, but we've introduced free of charge healthcare accessibility to the free of charge healthcare to the residents of both regions. So if we have anybody that we consider all of them residing in those regions, still the citizens of Georgia, because we consider those regions definitely as part of Georgia, as a united country, they have the possibility to cross over and then have free of charge assistance of any kind that they need when it comes to the health assistance. It could be complicated surgeries even, and it could be even in some rare occasions, possibility of treatment outside of Georgia as well. So the state developed a well understood strategy of using this tool as a way of outreaching to those with whom we've had war decades ago. Now we are separated by the Russian forces and occupation, but we are saying that we're here for you. So if there is a need, you can get free of charge healthcare assistance in Georgia. Even more than that, a special hospital was opened right at the vicinity of the occupation line of the region of Abkhazia, for that matter. So it's even convenience that was extended to them so that you don't have to travel all over in different cities of Georgia, but then right there at the occupation line, if you could cross over, you can have a well-equipped modern hospital that you can get healthcare assistance. That played quite nicely, I would say, when it comes to how much and what kind, and that's an important element to mention, patients we've had that came over for the medical treatment, former combatants, families that have lost their family members, and they would come over, they would get treatment, and they would even speak about that in social media from time to time. One important takeaway that we've had, and then we'll finish, I know the time is limited, we've never made that a communication strategy in an open way. We understand the sensitivity of this issue, so I'm not here again to tell about the statistics, about all of the details related to that initiative, because it's important for some of those to be off the radar screen, because the key is to build that confidence rather than just boast about it in terms of what we do, to be open and being encouraging connectivity of this type. And we'll have later time, I could specifically speak about COVID-related initiatives as well, because that has been a particular moment as well in which different countries dealt differently facing the conflict-related situations based on whether or not there are active hostilities or not, and then what could have been done. And in our case, approach was very open at the time as well, providing the vaccines if there was need for that, receiving the patients who were eager at the time to come over and then get treatment and on the territory that is controlled by the government of Georgia. And that was against the background when Russia itself was in that wage of propaganda machine about COVID, as if, about treatments and everything. And Russia itself had enormous problems, as we all know, the way it coped with COVID-related problems, and they wanted to transfer that to the territories that they control under occupation. So it was harder to outreach societies at the time because it was deemed to be much harder controlled at the time by the Russian authorities. But still, I would say, especially with the region of Abkhazia, the outreach was quite successful at the time.
Thank you very much. These are powerful examples from Dr. Moeti and Dr. Tikashilashvili about how health can create that capital of confidence, both in the moment and for later, to be able to build upon should an effort at a political level to build peace take place. I'm conscious as well, Dr. Moeti was talking about very positive examples in the polio eradication effort in northern Nigeria. I'm also very aware of how that's gone sideways in places like Pakistan and Afghanistan, and actually been, in a way, politicized. And one of the very important parts of the Global Health and Peace Initiative that we state, all of us, up front and loudly and multiple times to make sure everyone understands is that this initiative is not seeking to politicize health in any way. On the contrary. And yet we need to understand the footprint, positive and negative, that health interventions can leave. We know that even with the best intentions, that a major health intervention can often displace the local health services, and more people can end up dying of preventable diseases like malaria than of, let's say, Ebola in a case when during an Ebola response. We have to be conscious of that impact. We have to be conscious of the fact that we are also putting people at risk as well in these situations, and how to handle that. So maybe Dr. Al-Harti, we've talked in the past about how health workers are often the most trusted people in their communities, for a good reason. And I speak as the son of two doctors, so I speak with some authority. At least outside the home, they're trusted by many. But we also know that they need to understand, in the context of the Health and Peace Initiative, they need to understand both the footprint that they have, the impact that they have on people's lives, and how that can be oriented to build more cohesion in a deliberate and intentional way, because that's not often what they're trained to do. They're trained to intervene and take care of people, their wellness, well-being. But the opportunity for them to contribute also to greater social cohesion is not always obvious. And it can tend to be, the response tends to be, but that's not in my job description. So again, we don't want them to become peace builders. That's not their role. But we have to recognize they're such trusted individuals that they are able to build that capital, as our colleague from Georgia was saying. What can you say from your experience in your region about that?
Assalamu alaikum, everyone. The greeting of peace. Start by saying hello to everyone, and thank you for inviting me. Such a distinguished panel. Actually, I'm kind of second guessing myself. Why am I here? I'm just a surgeon, so trust is a very interesting word. I attended a session yesterday morning where the Director General said that trust is earned. Now, he should have added something to it and let it to be me to correct the Director General. But trust is earned when actions live up to the words that are given. And I think healthcare workers, no matter what they do in the healthcare industry, have always lived up to the words that have been the promises they have given to individuals or populations. Let's remember the 180,000 healthcare workers that died in this pandemic. And let's also remember the 360 cases of attack on healthcare workers in the Emerald region alone. These people deserve the trust. They did not get it easily. And once they have earned that trust, I think the respect should be given. Now, you mentioned in the beginning of your talk about the DRC. And sometimes we take this trust that is given to the healthcare workers for granted. But we are living in a world where misinformation can just as easily break down that trust, even though no actions were taken from the healthcare workers to lose that trust. But this is the world we're living in. And just to add to what you had mentioned about the Ebola epidemic in the DRC, there were actually two epidemics. One in a peaceful area where trust was maintained with the healthcare industry. And as you know, that epidemic lasted only 3 months and it was over. Yet the one that happened in the Eastern DRC lasted for 2 years. So the issue is that we definitely don't want to take trust for granted. We don't want to lose the trust of the populations. But I have personally worked in conflict and vulnerable areas. And I have noticed that no matter what your background was, or your ethnicity, or your religious beliefs, the local populations already assumed that you were there to serve them and that you did not have hidden agendas. And this is where, again, when we started this initiative with Switzerland, we always, when we engage with either member states or NGOs, they would bring up, we don't want to politicize this. We don't want to lose the cachet, the capital that we have with these populations. We are the only people that can actually access these places at either before, during, or after the conflict. We do not want to lose that accessibility. Yet, this is what we try to re-emphasize. It might not be as glamorous as what we would like it to be, but this initiative is not about peace. It is about the delivery of health care and delivery of the human rights of every individual in these places. And we hope by doing that and by securing that, that peace will be the byproduct of the delivery of healthcare.
Very good. Yes. And if I can just rebound on what you're saying, from my own experience traveling all around the world and particularly in conflict zones, I must salute the World Health Organization in particular as an agency that tends to be amongst the most trusted of all the agencies in that country. Why? And I saw this most recently pre-24th of February invasion in Ukraine, is that whereas many agencies of the international system rush to where the problem is, because that's often where the funding is, that's where the most acute needs are. WHO not only does that, but also has a responsibility to enhance the entire health system of a country. And therefore, they are present elsewhere. They are present where much of the system is not. And as a result, that proximity, that constant care is a source of trust building. And we found that WHO is particularly respected in that way by communities for that reason.
Yes, Claude, if you don't mind me adding, of course, we started with Switzerland with this and decided to work with the WHO because it is always seen as an honest broker in these areas, as you mentioned. And they're there before, during, and long after the spotlight has moved. Some of these conflicts or these vulnerable areas might not be in the media or the news cycles anymore. But our people, the WHO, remains there.
Correct. And we're joined here by Mr. Assi, the former Secretary General of the IFRC. And that's another agency, I must say, not to put you on the spot. I know we'll be hearing from you later, but it's another agency that has that deep respect in communities through the national societies. Why? Because they don't come and go. They're always there. They're always present. They're at the side of communities. And this is perhaps one of the more important lessons, I think, that we can draw from this about how not just being fair weather friends, as we say in English, but being there in good times and bad times is a source of trust building. If I can build on that and ask, I'm going to turn to Anne Levy from Switzerland in just a second, but I also want to warn our colleagues. We're very privileged to have three very senior political figures on the panel who have been at the height of their country's systems. And I'm curious, perhaps when we get to you, as to your experience about how to create coherence across an entire government in its behavior in this way. We often see one of the problems that we see is how siloed these different issues are. The health sector stays in its lane. The foreign affairs and colleagues working on peace more directly stay in their lane. When you have a reconciliation commission or a body working on social cohesion, it stays in its lane. But as a leader trying to bring coherence, recognizing that in the lives of local people, they don't separate these things out in neat ways. It's all part of their existence. How did you or how could leaders better integrate these efforts across an entire government's behavior in the interface with communities? But maybe now turning to Anne Levy, Switzerland has been co-chairing and co-leading this effort on the Global Health and Peace Initiative. Why is this important to Switzerland to be doing this at a multilateral level? What was missing, or what contribution do you hope it's going to make, and how do we get more countries behind this going forward?
Yeah, thank you very much for the invitation, for the question, and thank you to Oman. I think it was very important for us to do this together. Of course, Switzerland has a long tradition in promoting health during conflict. So talking about the Red Cross initiatives, which now, of course, is normal to have in conflict areas, and sometimes even the only one. But for us, it's really rather the other way around. So to say that actually health intervention can be an entry point in dialogues, in conflicts, to talk with different conflicts, and that's actually the part that really is interesting for us. And that's why we're very grateful that WHO made it a focal point itself, because I think we cannot talk about health without peace, because if there is no peace, it's very difficult to have health. And I don't mean health only like in a classical way, so lack of absence of or to treat even sick people or ill people, but also to look at a little bit brighter. So we talk about mental health, we're talking about nutrition, we're talking about the healthy environment so that children can grow up in a healthy environment. We talk about good air, so you need good air to have a healthy life. So it's all much broader, and I think, and Switzerland, that's why Switzerland is so committed to it, that we need a broader view of health to have a healthy life all over the world. And we've seen through the pandemic how important it is that we cannot just look at one country or one continent to talk about health, but it's all going together. And we really think that in a conflict, it's really difficult to have health. So that's why that global health for peace initiative is so important to us.
And what can we do to get other countries behind this initiative? How do we broaden the alliance?
Well, I would rather say it's interesting that countries are not interested to participate, because who could anyone be against it? I mean, if you really look at health as an entry point, I don't think that boundaries or conflicts are important. It's really to stay all together that we can assure health in all countries at all time, actually.
Right. So the challenge is on all other countries to explain why they're not involved. That's, I think, a very, very good. So let's flip it around. Let's not be convincing. Let's put pressure on them for, create some fear of missing out, FOMO, to be involved. Perhaps I can turn to Prime Minister Papandreou. So my first challenge to you three leaders is a cross-cutting challenge, and I hope you'll take it up in your intervention. But you've, of course, you have a practical experience with collaboration, for example, with your big partner to the east, in terms of creating confidence with Turkey over these years. And health was one of those vehicles. Can you tell us a little bit about how that can be a powerful opportunity at an international level to improve relations?
Well, thank you very much. Very short comments on my experience. I became foreign minister at a time when there was high tensions between Greece and Turkey. We were almost at war. And we started a very difficult dialogue. A few months in my term, there was a huge earthquake in Turkey. I decided to take a risk. I came in on television, I said, yes, they are our enemies, but they're human beings, first of all. Let's give blood, because they need it. The initial reaction, some minister in Turkey said, why can't take Greek blood? But finally they said yes. The next day, after 3 days, the doctors started calling me from the hospitals, and they said, can you tell people to stop? There are too many people coming. We cannot deal with this. So what we were doing, actually, we gave agency to our citizens to deal with this conflict and feel that they could be part of dealing with this conflict that we've been dealing with over these years. What that created was a cataclysmic movement of citizens diplomacy, which then just continued and continued and continued. We actually had quite a few years of this very positive situation. And luckily, these days we've been in tension. But it also, the month later, we had an earthquake, and the Turks responded likewise. Another quick example, Cyprus, a divided island, 1974, a war, northern part occupied by the Turkish army, two communities, Turkish Cypriots, Greek Cypriots, divided by a wall, basically. At some point when I was a minister, there was a young Turkish Cypriot boy who had leukemia. They looked around in the Turkish Cypriot community for a donor, for bone marrow. Couldn't find anybody. The teacher union reached out to me and to Ismail Cem, who was my counterpart in Turkey. And we said, okay, let's look and see if we can talk to the teachers union on the Greek Cypriot side and see what we can do. We did. We found a donor. A child gave bone marrow. Think of the symbolism. Turk, not finding in the Turkish community, finding the DNA in the Greek Cypriot community. Turkish, Greek, Muslim, Christian, how similar we are. So I think what I would say as a policy, these are opportunities through crises. And the pandemic is a huge opportunity for humanity. It's brought out the inequalities, it's brought out the problems in our health systems, it's brought out the problems in our education systems, it's brought out the need for cooperation. But there are different leadership styles. And I think this is where this community here can really play a role, because you all are leaders in one way or another. And WHO, of course, is a leading organization and one that trusts. There's one response, which is the normal knee-jerk response that we politicians have. Let's get back to normal, you know? Yeah, this is terrible. Just go back to normal. But normal is not what we want. If we think of the climate change, if we think of the One Health, livestock and environment and so on approach, if we need to give agency to our citizens, if we need to move from, as the secretary said yesterday, from sickness care to health care to prevention, we need change. So going back to normal is not the way. There's another leadership style, which is, I am here to save you, the Trumpian style, if you like, with some grandiose idea, like drinking chlorine or something like that, which usually does not work, and which the end up turns, it moves into polarization, politicization. Well, I would change a little bit the word, let's not politicize. I would say everything is political. The question is what types of policies, and what are the ethical basis of these policies? And the third approach would be use it as an opportunity. This is an opportunity to really bring change, and we should not lose this opportunity to bring change in the world around the need for multilateral cooperation in this time of war and rivalry. Talking about, this terrible discussion about weapons of mass destruction, the whole issue of how health systems really need to be boosted. I think this is where the community can really play a role to use this opportunities before the window closes.
Thank you. Can you just say a word about the challenges of getting different parts of your government working effectively together? Or
Certainly.
Or was it simple and easy?
No, not easy at all. And we in any organization, but particularly in governments and depending on the country, but you have silos in organizations. What I did, well, there are a number of areas, but one thing I did, which was I started and I brought in, I think it was 6 ministries: health, education, tourism, agriculture, environment, and we have a climate change ministry also. And I said, how do we bring all these ministries into our school books? Food, health training, local products, which would help tourism and develop local products, and also healthy green products and biological and organic. How do they impact environment and culture also? I brought in culture ministry too. How do you bring in culture? So I brought them together. They started actually producing some books around this issue. But it has to be this, and luckily in an organization has to be more top down than bottom up.
Or otherwise that collaboration doesn't happen by itself.
No, it's very well, it may, but you don't want to leave it to chance.
Right. But the question of what forms of leadership, what styles of leadership, maybe other panelists have some thoughts on that, on what it takes. But maybe we can turn to our president here to help us understand, President Tadic, about the opportunity that you see in a world as the Prime Minister was just describing, that is more fractured, more polarized than it has been for a very long time, since the end of the Cold War. what opportunities do you see at an international level for health to be a unifying platform or opportunity for collaboration at an international level?
Let me say just before starting to talk about this, that the lack of access to the food, energy, clean water, and fresh air is bringing people into the conflict. But I see that in this room, we have a problem with the fresh air. And that would be very good if we can provide something to avoid a conflict between us. And but in general, my experience is bringing me to that conclusion that sometimes big disputes are bringing the states and the ethnic group into the conflict, but at the same time, sometimes very small differences between people are bringing them into the conflict, which is, I mean, for some people, bizarre situation, but this is in reality what's going on. Nowadays, we are talking about conflict between West and East. We are talking about conflict between United States in general and NATO and Russia. What is the dispute between them? This is a security issue. This is territorial integrity, respect to the current borders and the states that are members of United Nations, and prejudices, lack of trusting. All those things are for sure some of the reasons why those big powers are into the conflict. Who is dying right now? Ukrainians. They are paying an extremely high price for the conflict which is existing for many, many decades. Going back to the conflict in the Balkans, former Yugoslavia, what brought us in the conflict between the people that are, in fact, same people, with the small differences. We are Bosniaks, Serbs, Croats, Montenegrins, we are same people, same genes, same DNA, same language, everything is the same music, even the same style of playing basketball. But we've been waking up in a bloodshed and a horrible conflict, killing each other, hating each other. That was really disaster. The problem is that we are facing with the real challenge how to identify the content of conflict and the potential of conflict in the world nowadays. And now I'm coming to my thesis and my final conclusion. We have a problem in functioning multilateral institutions, not only states, because we are not focused on prevention of conflict. I'm using the example from medicine. The prevention of the disease is a key. First of all, this is making people healthier. Second, this is cheaper, and this is more sustainable. But regarding the global community, we don't have the same access to the states and the global peace like to the individuals. This is, from my point of view, a huge problem. Whenever I'm participating on such forums, I'm insisting on creating a kind of global health diplomacy to bring more expertise in multilateral institutions. The people that are able to be focused on potential conflicts, to identify zones all around the world that are right now existing as a conflict, but also to identify the zones that can be conflict in next 2, 3, 5, 10 years, which is real, very important prevention. I used to be president of Serbia after conflict that happened in the former Yugoslavia. And I didn't work on implementation of the peace. I was working on reconciliation process. That was even harder than implementation of peace because everything what happened, human victims, horrible destruction, the horrible experience between people, lack of trusting. And this is why I'm always insisting on prevention of conflict. Looking to the Nobel Prize winners, for peace. Usually the people awarded with that prize are people that has been implementing peaceful agreement, but no one is bringing awards for the people that are preventing conflicts. And this is very important to be focused on that nowadays. We are going to create much better human society, more sustainable multilateral institutions, and we are going to bring new credibility to the multilateral institutions. This is why whenever we are talking about conflict, this is very easy to blame someone for conflict, to say you are guilty, to accuse something, like Zola in affair Dreyfus, and but it's much more difficult is to understand what is the substance of conflict, which are deep anchored lying into the conflict, and to understand mechanisms of conflict. And I'm finishing with that. States are acting like individuals. Whatever I was learning on my university was very different from what I've said right now. We cannot say that states are behaving like individuals in the theory, but in practice, this is exactly what's going on. States are like individuals, immatured. They have prejudices, emotions. They have a problem in reacting. They are not rational, especially big states, big powers. Because they are starting to analyze, to treat the other world states from the podium of arrogancy, because they understand we are more wealthier, we are bigger, we are more powerful, we have a right to treat other states and other entities like this. And this is a big problem. My experience is that the leaders of the big states are creating so many mistakes, which is bringing whole world in a terrible conflict. If they are going to learn something from the leaders of the small states that are fighting every day for surviving, finding solution for their own problems, not to start to analyze world and to treat world from the podium of arrogancy that I mentioned earlier, we are going to be in a much better situation than nowadays. We see many conflicts right now, horrible aggression from Ukraine from Russia against Ukraine. But we can remember the same situation with Iraq and Syria and Libya, and who was aggressor in that time? United States. And the many lies, prejudices, manipulations with the information has been foundation of that kind of conflict. And nowadays we have to think about all those things very seriously and to try to form the kind of structure within multilateral institutions and to bring credibility to multilateral institutions by working on that issue with more expertise and more knowledge.
Thank you, Excellency. Indeed, you state how large states are behaving like bullies in a way, like individuals throwing their weight around. There's also, since I would say since the COVID-19 pandemic, there's also been a breakdown of trust north-south. In addition to east-west, like we're seeing now, there's been my former chairman of Interpeace, President Martti Ahtisaari, used to say that the best way to create an enemy for life is to humiliate them. That in fact, we have a responsibility to protect the dignity of all, that we should go out of our way to ensure that the dignity of all those that we are interacting with is protected and promoted. And I think that's a natural human feeling. Individuals feel that, so do states. And increasingly, we're seeing that sense of humiliation, sense of lack of respect is poisoning international relations. And the hope was that the health intervention, the global health response to COVID-19 would have been an opportunity to address that differently. And we missed that opportunity, it feels. At least that's the lived experience of many, many countries. If I can turn to Dr. Moeti, there's a challenge that I think is also present in this conversation that we haven't discussed enough, which is the long-term engagement, the long-term effects long-term health needs of societies and how we meet them. In particular, one of the things that we're very sensitive to at Interpeace is on mental health and psychosocial support needs after conflict. We're still dealing today, after 28 years, with the mental health needs of Rwanda, for example, after the genocide, where 1 million Rwandans, according to the Ministry of Health, have debilitating mental illness. And we know that the cycles of aid, and including medical emergency aid, as was stated in the report that ASI and others put out not too long ago, following the pandemic, was this tendency to move from panic to neglect, right? And yet we need a sustained engagement on issues like mental health over the long run. Otherwise, societies, to pick up on what the president was talking about in terms of reconciliation, societies that are harboring serious mental challenges and traumas, it's very difficult for them to make that step of reconciliation. We've seen that ourselves in so many countries. But that sustained engagement is not there. The funding in a sustained way is not always there. Do you see that problem first? Do you see that need? And how do we overcome that in terms of not just providing emergency aid to displaced people on mental health, but also helping to strengthen the health system for mental health?
Yes, thank you very much. I think first on mental health, even before such a problem as the COVID-19 pandemic, even in countries that are better resourced than the sort of countries that I work in the African region, that's been an area that's been neglected and has received much less of attention at all levels, at the community, family level, and in the health systems of countries for decades. So I think there's a situation like this, like the COVID-19, which has heightened the awareness and so exacerbated the problem and the burden of mental health, really could be treated as an opportunity in the discussions that are going on now, as we, with some sense of relief, at least in many regions, not quite yet in the African region, recognize that we are transitioning to another phase following this pandemic, but with a strong sense of awareness that the next crisis could be around the corner. I think that the scale of this problem and the way it went to countries in very different situations in terms of their wealth, the capacity of their health systems, has driven home that point of vulnerability. And so rebuilding, there's a great deal of work now on rebuilding the systems, thinking a lot about the resilience of these systems going into the future and how to be able to respond to the next pandemic and pay better attention to those problems that have been highlighted by the pandemic, not only mental health, which has been very starkly highlighted by the pandemic, but other chronic diseases, if I take the African region, that have been there, that are even more prevalent in terms of mortality than communicable diseases, that are completely neglected, off the screen. So how to rebuild, build in the resilience in sustainable ways, in affordable ways, perhaps. Looking at global solidarity, which was a huge challenge in response to the pandemic. But having shared this vulnerability, hopefully going forward to address both the chronic problems that need now urgently to be addressed in a sustainable, long-term fashion in the context of what's available and affordable in countries, and working together, having shared this problem, that I would expect that we will progressively, as one world community, having learned the very painful lessons of inequity that you are emphasizing, find ways through the global funding mechanisms to deal with pandemics, but other ways to support resilient health systems, access to essential services to all people in all situations, including very much for mental health, for basic healthcare, that some new way of working together is going to emerge, not just on pandemics, which is what major conversations are about, how to prepare together, but to remember that the pandemic disorganized healthcare systems for many things in many countries, access to vaccination for children, women have died in childbirth, gender-based violence, and that we cannot as a world continue and have another cycle of that go on. And I think if we take mental health as an example, there are ways of addressing mental health that don't necessarily need highly trained specialists in big hospitals, where we can adapt the approaches so that we can provide basic counseling care through nurse practitioners, other available healthcare workers, community support, and community initiatives for mental health that will make sure that we don't find the world in such a situation. Hopefully, and I think this is what we are aiming to do in WHO in terms of the going forward with universal health coverage, with building resilient systems, with primary healthcare really translated in the context of countries, and with sharing resources, hopefully, across the globe.
Right. You know, in the peace building field, just to pick up on what you're saying, in the peace building field, we often define peace building not as doing away with conflict. Conflict is natural to society, just like, you know, antigens are natural to it. We'll come into contact with antigens all the time. Mm. The challenge in peace building is to strengthen the capacities of society to manage conflicts, both the ones now and ones that will come later, right? It's in a way, it's about strengthening the immune system of society to deal with what may come. And at the core of that is the ability of communities to trust one another, a state to work with its people to address issues that may or may not come up. So the linkages are quite strong. And perhaps, Dr. Al-Harti, you're a trauma surgeon. So I presume you've dealt with, or you deal primarily with the physical wounds of traumatic events. But we've seen that not addressing those invisible wounds can actually keep a society back. Is that your experience? Have you seen that in your work?
Sorry, do you mind repeating the question? Not addressing the...
Yeah, so as a trauma surgeon, you're dealing often with the physical wounds of trauma, but the invisible wounds of trauma that people harbor as an obstacle to their ability to move forward, to work with their community, to build a society. In Rwanda, they have an image that's quite powerful of a hole in the bottom of your chalice, that you can pour all the development you want into the chalice, but if you don't deal with that mental illness issue, it'll all pour out the bottom. So
that's very true, Scott. Actually, speaking of Rwanda, I had the honor of visiting Rwanda, and I must say it is one of the countries that chose the right path, did reconciliation pretty well, and is heading in the right direction in the African community. There are leaders to what can be done, but as you mentioned, the focus is on economy, education, and moving on forward. And you know, I'm a surgeon where feelings are not a priority usually. We always say, you know, cut right, and you know, I would rather have somebody who knows how to cut right rather than have somebody hold my hand to the grave. However, there is no going about it. You know, in the last few years, we have seen the importance of mental health, not just for the populations that were affected, but also how it affected the healthcare workers themselves. You know, we have done things pretty well in the pandemic. I know that you can either choose the half glass full, half glass empty. I am usually known as a cynic, but I choose to see the experience of the pandemic as in we did much better than what we would have done if this pandemic hit us 20 years ago. The pandemic itself, like the coronavirus, of course, was very serious and did cause a lot of damage. But some of the damage was our response to the pandemic itself. I am a father, I have kids, and my kids were, like many places in the world, taken out of school. They did the online learning. Don't know how much learning happened there. I had another kid who was in university abroad who had to physically leave Oman, be in quarantine to attend that university, yet he had to do the online learning in a different country. He could not do the online. It was not good enough for him. He had to be in that small town, but still on the other side of the computer. And after 2 years of that, for the first time, I actually saw my son break down and say that, I don't know if I can do this anymore. And it wasn't the studies. It was a phrase that he told me. He says, I know people, but I don't have any friends. The damage that we have caused not to just the children, is not going to be recognized now. I think we will see it way down the line. These people have lost their social skills. They don't know how to interact with people anymore. We have taken away the precautions, yet people don't know what is normal anymore. You walk, in the streets and you find an individual walking by himself, and he's outdoors and he's wearing an N95 mask. What does that say about us? I mean, we are great in science. We know a lot of knowledge, but the transfer of knowledge and communicating when to do what and how does it really help you, we have significantly shown that we can do much better. Now that's with the populations. Now the other side is the healthcare workers. And yesterday there was a very good session about the Great Resignation. Unfortunately, there was a lot of good information there, but we didn't tackle why are people leaving. And the healthcare workers, you'd think it's just burnout, but if it was just burnout, it would be the people in the ICU, the people in the emergency department, the ones who actually saw the effects of Corona. But we're seeing it all across the board. It's not just those who were in tertiary hospitals. People in primary health centers who were vaccinating and were supposedly seeing the good side of what can happen in the pandemic are quitting. People are reassessing what is important for them. What does this life mean? And I don't think we're giving them, I wouldn't give them the answer because I don't have the answer, but at least we're not giving them the tools where then they can get to that answer. As an intensivist, people always remember me as a trauma surgeon, but I have worked in the ICUs. And the fact that we have separated really sick patients from their loved ones in the last few days they had of their life, and then when they died, we buried them without their loved ones being there. And in our culture, there is the funeral process is a big part of the closure that you have. I'm having conversations with my family members, and I'm suddenly discovering that we have lost family members, but because we did not have a funeral, we did not attend the burial, I failed to understand that this person isn't with us anymore. So yes, I didn't want it to make it too emotional, but we are way behind on what we can do on mental health. And it is not just the healthcare workers, it's not just people who were affected by COVID. And we know that there is physical changes in the mind, in the actual brain of people who got COVID. But we have affected people who have never got COVID, and I'm talking about the children, and we can't even imagine what the effects that's going to be down the line. I don't want to be a psychiatrist, I don't want to be a therapist, but I wish them all the best. We need a lot of them in the coming years.
Okay.
My wife is a speech therapist working with little ones who are acquiring or having difficulty acquiring the ability to communicate. And just the act of having adults wear masks, where young children are not able to see the cues, the facial cues of adults, has kept them back. There's going to be a definite impact of even just that little aspect of it going forward. We're going to come back to the panel in just a second. We have a lot more to discuss with the panel, but we're very honored today to have Asi with us as a keynote listener. If you're not familiar with the concept of a keynote listener, it's a really cool concept where you have a very prominent person sitting there and listening, which Asi is so good at, but he's also so eloquent and wise in terms of speaking. So we're going to ask him to speak. And this is an opportunity for you to comment on what you've heard, to stimulate the discussion with the panel. And then we're going to open up the floor to the audience, and hopefully at some point in the Q&A, we'll be able to link up to our esteemed colleague, the Minister of Health of the Central African Republic, who should be online with us, I'm told.
He is.
There's okay, you have the microphone. Very good. Over to you.
Thank you very much. I would have loved to continue the cool status of listening. Because honestly, there is not much to add to the excellent presentations that we have heard already. But maybe just some illustrations to kind of emphasize some of the very important points. Working in Somalia, in the Al-Shabaab area, we woke up one day and Al-Shabaab said, you guys all leave by 5 p.m. All UN organizations, all humanitarian organizations. For some of you who know that area, if Al-Shabaab tells you to leave at 5, you better leave at 4. So we all lined up, packing up. So one of the guys, with a Kalashnikov come towards me and say, but you're okay, you can stay. I say, well, my colleagues, start, making all kind of speculation. My name is El Haj Amadou. Say, oh, okay, he's a Muslim, etc. So he came back and say, you stay because your organization never left us. So that's what you said, Dr. Abdullah and Chidi. You'll be there before, you'll be there during, and then you'll be there after. Because building trust in the middle of a conflict, building trust in the middle of a crisis, it is simply impossible. And I think we need to also simply to draw the lesson that communities, they have a memory, they remember. So many other times we have known that, for security reasons, when there was a shock or a crisis, there was a tendency that we pack and go until things are normal, so we come back again. And often when we did that, we were living behind not only the communities we serve, but our local staff and our local colleagues with whom we're working. And then we, the so-called expats and internationals, live. So I happened to work at the time with an organization, UNICEF, let me say it, that was there all the time. And as much as I wanted to take, the compliment and brag about anything I did myself, it had nothing to do with it. It is simply to the fact that the organization has been there before, has been there during, has been there after. And I think in a recent crisis, that particularly in the Africa region, I can testify that we've seen, what health workers were doing. You go to northern Mali today, and then you look for what is left of any sense of formal government structure. Schools are closed. The prefect has left. The military, deserted. Only the health post, remain. You go to northern Nigeria, it's the same. Burkina Faso, we were there together. That's what you see stay. And then trust building is not about talking. It's not about engaging. It's not about even sharing a culture, religion, and all of that, because people who share all of that also be in conflict. It's about being tested on the ground, and then they look at you, will you pass the test or not? So, and then they have their indicators on how you pass the test. You never leave us. You always be there to accompany, those people in need, to respond, to their need. Second point, in traumatized communities and communities in conflict, often families and their loved ones and children have almost nothing in common, to come together. But maybe the only thing that most of the time, they have in common is their kids being treated in the same health post. And then their wives, giving birth in that same health post. And then it is very moving, sometimes, when you meet people, in a refugee camp, and then they come together and then they introduce each other and say, we are relatives. We are very close. We are very close relatives. We are friends. We are family. And so, okay, what is your family? Oh, our children were born together in the same outpost. That was the family tie. And that is, what they call, relatives. It's not by chance when we work in those settings that we are targeted. Those who target us know that they're doing. Because now, if they would like to destroy the last things that, this community have in common, they go directly to that exactly what is tying them together. And that is most of the reason why, they're not stupid, crazy people who are just shooting, in the air and then, shooting ambulances that is passing by. They know what they do because they understand, how important, those health facilities are, how important, it can contribute into creating social cohesion, how important, it is to help people withstand, some of the misinformations and also the manipulation that will be coming, from, other side. My third and last point, and I would like Chidi to elaborate on that. You remember when we started responding to Ebola in Liberia, Sierra Leone, we were even being rejected, and communities were reacting, to even stone us. Exactly for what you were saying, Dr. Abdullah, we needed to do what we remember what we called dead body management. And for communities, you don't manage dead bodies. What you do is you respectfully accompany deceased people to the last place of rest. And that is the last thing, they had. And then we wanted to cut that and then to do it. And words matter there. The move, from dead body management to safe and dignified burials, and then building trust, so that they can entrust you maybe with what is most important to them, meaning to accompany their loved ones in a safe and dignified way, in the true respect of their roots, their culture, and their religion, was maybe the greatest achievement that anything else that contributed to the acceptance and then the trust, building. I'll stop there, and maybe you can build on that, Chidi, to just elaborate on how much that has been important in continuing, to the responses that, like the ones we are having now, in Uganda, like the ones, that we recently had in the Democratic Republic of Congo. And it is not by chance that it is not in Kinshasa that was happening, but in Benue, in Butembo, exactly where you have, that combination of conflict, health, diseases, challenges, and then climate, all together, where trust and respect and long-term engagement, and I stress, long-term engagement to deliver on the promises we made is very important. Thank you.
Thank you. Thank you very much. Thank you very much. We're going to open the floor for questions and then take both the response to that comment and your questions together back to the panel. We have a gentleman at the back and then Madame here. Take 3 or 4 questions and then turn back to the panel.
Hi. First of all, thank you for the interesting and valuable discussion. My name is Zafir. I'm a doctor working in Berlin right now. I worked for the Palestinian Ministry of Health 2 years ago. And basically, there are relations between the Palestinian and the Israeli Ministries of Health. As many Palestinian patients who need advanced neurosurgical operations or needs advanced cancer treatments are being transferred to the Israeli tertiary medical centers. And according to my personal and professional experience in the Ministry of Health, sometimes the political situation affected the decision of accepting those patients. So my question is, shouldn't these kind of unbalanced and unequal relations, shouldn't these relations be supervised by external objective body to ensure that healthcare is achieved beyond politics and not to be affected by the fluctuating political situation? Thank you.
Thank you. Madam here, she has her hand up.
Thank you so much. Thank you so much. I'm Zuhal Hamadi. I am from Yemen and work in communication and advocacy. Really, thank you for touching base on the very important topic, which is trust, which is a really complicated term, and like hearing all this experience about how to build trust between the health workers and the health system with the community. The question here is really like to the panel, how do you measure trust? How really do you, like that at that point, you feel like, yes, we achieved the trust with the community and the objectives of our project was really achieved. I'm just curious to know about really how to measure that. And also about like the role that communication can play during crisis in building trust within the community, within the different parts of the community, like decision makers, organizations, community members, health workers. I'm just like curious to see or to hear more insights, best learning and best practices. Thank you.
And one more. Oh gosh. Okay. Maybe on this side. Well, colleague on this side.
Hi, my name is Niti Katsar. I'm a medical student here in Berlin. I enjoyed very much your point and your idea of this global health initiative agency. And it reminded me of the idea of the newly found WHO hub here in Berlin that will try to provide preparedness and kind of surveillance to foresee upcoming emerging pandemics and viruses. And you suggested you would like to do something like that in the direction of political crisis and wars. My question would be, could you provide us with some specific practical examples of how such an initiative agency would actually ensure that at the end of the day, even if it comes to the outbreak of a war zone, that we will ensure the security of the civil society, but also health provision? Because I think at the end of the day, the first that are to jump in, and now I'm quoting you, Your Excellency, Mr. Papandreou, are always normal people, like everyday people, the community and NGOs, and we have plenty of those, even more than enough sometimes. But what would the difference be on what you suggested that we should try to form?
Thank you very much. So we're going to take a quick round of responses from the panel, and we have the Minister of Health of Central African Republic on the line, who's also going to provide kind of a last commentary. Perhaps we can start, Dr. Moeti, do you want to respond both to Mr. C's point and then also on how do you measure trust in the work that WHO carries out?
Okay, thank you very much. Actually, as you expressed this so eloquently that I really don't have much to add. I think that the lessons that were learned during that Ebola response very much informed what happened subsequently, I think. And I mean, and we've decided in WHO, for example, that when something like this does, you don't just send out an epidemiologist and somebody to count the numbers, a data specialist, but you need to immediately engage with the community and start to work with them to understand their particular context, their practices, and what will enable the response from the very beginning to be integrated into what they consider to be their norms and take into account and respect the way they deal particularly with burials, because in our cultures collectively, this is one of the most important aspects. And we learned actually from survivors of the epidemic in the past that people are really conflicted about not having fulfilled their responsibilities to their deceased family members. So this contributes to emotional issues, even mental health issues in communities that have overcome these outbreaks. So it's something that's very important. It demands deliberate investment in the teams, in the capacities to set out with that in mind as one of the pillars, as we like to call them, of the responses. It's extremely important.
And can I just add that it's not, the burden is not entirely on WHO or healthcare workers to do that. That there needs to be greater partnerships
So, yes.
with development actors, with community organizations, with peace builders as well in certain cases to do that. Now, perhaps I can talk to move to Eka on the issue of, we heard from the Palestinian colleague on the perhaps the need, and this is also perhaps a question for Madam Levy as well, is on the need for some form of health diplomacy that would allow for collaboration or at least services. You were talking about providing those services across the conflict line in with Abkhazia and Southern Ossetia. You were doing it naturally, but perhaps is there a way to do this at a more global level?
Well, I think that we need to be very careful and have a granular approach to every conflict as a sui generis case, so to say. It's very dangerous to extrapolate an example of one country and one conflict and then have a global approach to it as if it's going to work in every other situation. It's so sensitive, so granular that it needs to be tailor-made. In some countries, if the extent of the access to the healthcare is so large when it comes to statistics of that you need to have an actual monitoring system of impartiality of that or accessibility of that and the politicization, as it has been mentioned, that it might be the case. But if you are at the stage when you are just kickstarting the process in the way that you encourage that to grow without actual politicization of the system, clarity of the rules, budgetary allocations, accessibility of it in an easy way, we have it electronically, it's digital. So you have the digital application processes and you get it very easily, for example. So as much as digitalized the processes could be so that you don't have discretionary powers attached to it into the system, then you are easy with that. So if you don't lose too much administrative resource in terms of managing of the process, it's more doable. But I'd like to add a bit more on the trust as well, because trust is really requires continuity and persistence of action. And then testing when it comes to you do what you say and you mean to deliver in the long run. And if you pass that test, then trust emerges along the way. But trust is, again, multifaceted. We don't have one single community with which you build the trust. Every community has different sub-communities and target audiences, right? And then when it comes to the health, medical personnel, it's a community in itself. One of the ways for us rebuilding of trust was to build trust between the medical workers themselves. And when you see that after the certain period of time, it kickstarts in the way that they start to communicate on their own. They have online consultations. And unfortunately, it happens so that in the place like occupied regions of Georgia, it's the worst example of where Russian medicine is, let's put it that way, the level of development right now. So accessibility to peer-to-peer relations of Georgian doctors in Georgia and elsewhere, by the way, because we have now community of Georgian doctors that are practicing in the US, that are practicing in Europe, they all opened up themselves for that communication. So we helped by having meetings that we organized in neutral territories first, and then it kickstarted now, even with well-established online coordination mechanisms that they have within the community. Because if doctors trust each other, that's a different layer of trust that emerges rather than they patients coming over to you so that you can treat them better. And finally, I cannot but not to mention on mental health, because there are different types of conflicts, different brutalities that we've seen in different conflicts that are being now ongoing and then have been in the past. In the case of Russian aggression against Ukraine, which is by now, it's a clear genocidal war in the way that one country denies the existence of another country and people as a separate nation. Sexual violence and rape en masse is documented already as one of the ways of waging the war by the Russian military forces. So imagine now millions of refugees, Ukrainians that are out or displaced in Ukraine. Massively, the rape has been used against women and even children. So when we speak about mental health, what is the degree of catharsis that needs to emerge? It's something that one needs to really reflect very deeply. And as a lawyer, I have to mention, closure comes with justice and sense of accountability in many communities and for many individuals. And then now International Criminal Court already has open cases on war crimes committed in Ukraine. And very soon, I would hope crimes against humanity and genocide will be open as well. And doctors, as I can see in the experience of my own country as well, and where ICC opened the case as well, doctors can have a completely different way of opening up the victims for them to tell the story. And even if it is not yet resulted in an actual indictment of their own cases being part of any charge against an individual, them being able to tell that story is the beginning of their recovery in so many ways. So coordination of doctors with those who represent the justice system, international or local, it doesn't matter. This is extremely important for the future of the mental health and societal cohesion in the future, because here we speak really about not only grown-up women, as unfortunate as it could be, but children even literally raped in Ukraine. So what should be done so that justice and accountability is served? Because the best way of prevention is accountability for what already happened. Russia never paid price for any conflicts that Russia waged, including in Syria, where cities were obliterated completely. And that's what Russia is doing now in Ukraine, bombing the civilian cities and then civilian infrastructure, because Russia was never held accountable for any crime that Russia committed. Accountability is the best way of prevention.
Thank you. Thank you very much. President Tadic, you've been thrown a challenge from our young colleague here, the student, to give a few insights into how to operationalize this idea on prevention, health prevention, as an organizing entity. Can you say a few words on that? And then we're going to turn to, we have 4 minutes in all, but so we're going to turn to our minister in just a second, please.
I think that the global health diplomacy is a new phenomenon, and we have to even define what is the role and the duty of global health diplomacy right now. But in the context we are talking today, I'm sure that without involvement of the doctors and medical sphere in preventing the problems in healthcare all around the world, we are not going to be able, as a mankind, to solve the conflicts we are facing with. Because lack of access to the medical, to the clean water, to the fresh air and everything else is a key in terms of protecting the health of the human beings. The problem with the health of the human beings, and specifically in some countries, is bringing that countries into conflict with the neighboring countries. In that respect, we have to think about that. But at the same time, this is one page. The other page is that we don't have a lot of expertise in terms of analyzing potential conflicts. This is, from my point of view, one of the biggest problems. The role of the NGOs and such institutions is very important, but they cannot work on that. This is an issue that has to be treated by multilateral institutions, I think United Nations. Such expertise we can bring only in United Nations, but my problem with the United Nations is that they were always focused on implementation of imposing peace, bringing peacekeeping missions, but not preventing the conflicts, which means to identify potential conflicts. This is something that needs not only historical knowledge and but also analysis in the world nowadays. This is really possible. Look Yemen, look Yemen, and that conflict which is between Saudi Arabia and Iran on the soil of different country, which is bringing the religious dispute among the Muslim world, Shia and Sunni. And everyone who has expertise in that was able 10 years, 15 years ago to identify that potential conflict and to make kind of prevention. Ukraine. Everyone was talking, especially from the United States, about potential invasion from Russia in past 1 or 2 years. But I didn't see reaction of shuttle diplomacy from the United States to prevent conflict. This is problem. We didn't see that. I never saw that someone from United States has been calling their colleagues from Russia and to try to prevent problem. This is my frustration nowadays. I agree with Eka. The Russian has never been paying price for what they did, but I didn't see that American has been paying price for what they did. And this is problem. They bombed my country without resolution of National Security Council of United Nations. No one was paying price. They killed the kids on the streets. Kids, they committed war crime also. Who paid the price for that? And this is problem. We cannot have a double standards. Without having double standards, we are going to be closer to better solutions. And in that respect, I'm always urging for health diplomacy. I'm always appealing on my colleagues to be more focused on the problems that are affecting the world nowadays. Someone have said we need more psychiatrists and doctors. I'm not, but I'm clinical psychologist. But my frustration is that only two of us were running countries. This is Madame Vicky Freiberger and me. I never heard that we have many psychiatrists and clinical psychologists among the global leaders. And we need that kind of skills also to show empathy, to understand other phenomena, to understand the problems that are existing. Not only to blame someone, but to try to understand different existence. This is very important nowadays. Thank you.
Thank you, Mr. President. The organizers have told me that we have their blessing to go over by 10 minutes. If you can stand the lack of air in the room, but we definitely want to hear for 3-4 minutes from the minister from the Central African Republic. Monsieur le ministre, j'espère que vous nous entendez.
Oui, j'espère que vous m'entendez aussi.
Oui, super.
Oui.
Vous avez pu suivre la discussion du panel, j'espère.
Très bien, parfaitement.
Parfait. Parfait. Est-ce que en 3 ou 4 minutes, est-ce que vous pouvez partager vos impressions de ce que vous avez entendu? And is this,
Tout à fait.
does he speak English? He does. Oh, peut-être en anglais.
Yes.
Wonderful.
Do you have an interpreter?
Sorry. No,
Pas
no
d'interprète,
interpreter.
hein? Okay.
We're told that your
Thanks a
English
lot,
is very good.
thanks. I don't know. You will see. You will see. Thanks a lot. Thanks, for inviting me to this very crucial conversation. I will just build on the last segment of this conversation concerning the link between war and health. Just saying that while we are emphasizing, the link between peace and health and peace, but we should not overlook the role of war in as a cause of disease and death. And this is what we have experienced in my country. I'm not going to elaborate much on this. I think the last speaker has certainly brought to the fore this important dimension. We need to have a dialogue on the role of war. And for me, war is a public health issue because it is creating death. It is creating violence. What I want to emphasize is the role, we are talking about trust, the role of health workers, and including the Minister of Health, taking the example of myself. I was appointed Minister of Health 5 years ago, and I came back to my country from the position of international civil servant. And the country was in the middle of a war. And my mantra from at the outset was to promote health as a cradle of peace. So I have used health as a cradle of peace to bring cohesion. And this has really been effective. And the way I have done that is to really play a key role. For example, by taking personal risk to reach out to armed groups and advocate with them for the fact that health facilities, health workers, and humanitarian actors should not be targeted. And making them understand that they are also the, they are also the target of disease, the target of war. And the role of Minister of Health is to protect them as well as overpopulation. They were really engaged in preventing health emergencies like the Ebola crisis. And this built trust between myself and the whole armed group throughout the country. They would call me to inform me that the wounded soldier that were captured are in the hospital, and I would take care of. They would like me to take care of them. Take care of them, and I would so engage them in the vaccination immunization campaign. And this has led us to be admitted by the WHO as a country free of polio. This has allowed us today to also have one of the best immunization coverage for COVID. I have been also a broker between the government and the armed group. I was doing that not only because I was Minister of Health, because this is a very sensitive position, but I was working with my heart and my soul of physician. I was using my position as a physician as the level of my work as a minister. And I would like to emphasize also the role of WHO, because I was doing that with the support, full support of WHO, of UNICEF, of a peacekeeping mission. They were the one providing me with the possibility to go to the remotest area, to areas that were in war, and many times with their company. And so I want to say that building trust, health workers are critical in building trust. In all the health facilities, as mentioned, whereas all the health, the authority, administrative and political authorities had left the places, only health workers remained. They were taking care of all the belligerents. And this is the evidence that health workers are critical in making peace. And we need, and the ministers of health has mentioned one person giving the example of Palestine and Israel are also critical. And for me, we need to really emphasize that we need to train our health workers in being resilient to aggression, to violence, and sustaining, so that they can sustain health services in difficult situations. We need to advocate for ministers of health to be really the advocate for health as a cradle of peace. And on one point that I want to emphasize is that the threat to the role of hospitals and health care facilities as a cradle of peace is the fact that when communities, patients coming from different communities.
I apologize, Mr. Minister. We have to vacate the room in 30 seconds. So I'm
Okay,
afraid we have to we have
just
to
to
stop
say
there.
that-
But thank you so much.
Thanks. Bye.
Thank you very, very much. And in fact, we count on your leadership as a Minister of Health to convince other countries and other ministers of health to get behind this. As Anne Levy was saying, the burden is on them to prove as to why they shouldn't be part of this agenda rather than why they should. I want to thank our panelists very much for everything that they shared with us. I have a whole list of follow-up points and things I would have liked to recap with, but we'll have to do that in the notes. Otherwise, we're going to be kicked out of the room, and we want to avoid violence. So thank you, everybody, for joining us, and please give a round of applause to our panelists.